Welcome, everybody. Delighted to have you here today, to have you join us, whatever time zone you are in. And I know it's, for some of us, it's quite early, and probably for some of you, it's quite late. Today, we're here to discuss what's next in global health equity. I'm David Peters, the faculty director of the Alliance for a Healthier World. We have a great set of panelists that are going to be talking today about global health equity, each of them from the perspective of different kinds of funding organizations that are funding work in global health and social programs. Now, for those of you that are new to the Alliance for a Healthier World, HW is a Hopkins-wide initiative made up of faculty, staff, and students, as well as partners around the world. And our focus is really bringing attention to complex and systematic health inequity issues. Our vision is to bring all of these faculty, staff, students from across the university together, along with partners and in disadvantaged communities around the world, to bring their full set of scientific, analytic, creative capabilities, again, to advance global health equity. Now, this initiative started nearly 5 years ago from the president and the provost, and we've done many of these events, over a dozen of them, originally in person and now virtually or hybrid over the last 4.5 years. We've also provided over 60 grants of different types during this period. We are organized around, these events have been organized around health equity, addressing issues like climate change, open access to technology, information, gender equity and justice, food systems. We also have a global health equity scholars program for students, and we're focusing on 3 areas: structural determinants of health, common goods for health, and health equity knowledge, management, and translation. And we'll talk more about that later because we're going to be announcing the next round of impact grants after we have the panel discussion. Now, today's discussion is for faculty and staff, and students may be joining us at the beginning as well, really to learn insights from people, perspectives from critical global health, that are funding critical global health research, and they all have important health equity, social justice dimensions. Now, we're not asking the panelists to speak on behalf of the agencies that they're working for. They may do so, of course, if they desire, but it's really to get their perspectives from the different organizations, the different types of approaches that they take to addressing health research, and health equity. So let me start off with Pamela Rao, who is earliest in the morning, I think. So thank you for joining us. She has a background in many degrees in economics, management, public health, over 25 years of experience internationally, including at many at USAID, FCDO, and other organizations, working on health system strengthening in a variety of contexts, and particularly on HIV. You can read more about her and the other panelists on the Alliance for a Healthier World website. She is now the Senior Program Officer and at the Bill and Melinda Gates Foundation and the Global Development Division, where she manages a portfolio related to the global financing facility for women, children, and adolescents. That's a multi-donor trust based at the World Bank, and was one that is committed to ensuring all women, children, adolescents can survive and thrive. Next up, we have Bill Clark, who has a background in finance, being a founding member of Campbell and Company hedge funds, where he's executive VP of research. Since 2013, he has been working full-time at his family foundation, the Osprey Foundation, which has been originated out of dedication to water, sanitation, health, and development issues in indigenous communities, originally in Central America, but really has been working around the world and in sub-Saharan Africa and elsewhere as well. Has an interest in ecumenical and interfaith issues, and has also been served as an advisory capacity at the School of Public Health Advisory Board, but also in others, the Open Society Institute and Impact Advisory Committee for Chorus International, which is a group of an umbrella group for faith-based NGOs working in health and development. And last but not least, we have Neil Brandis, who is a longtime colleague and friend who has dedicated his work to global public health. He is, as we say, a champion for evidence-based programming and policies, worked years on maternal child health and health systems, strengthening them in strengthening health systems in low and middle income countries, and really led much of the thinking of and organization of USAID's research in these areas. He is the chief of the Division of Research and Policy in the Office of Maternal Child Health and Nutrition, previously worked at RWJ Foundation and at the National Academies. So with that introduction, I'm going to pose a couple of questions and ask the panelists to respond, then we'll continue on with the questions and discussion. And if you have questions in the audience, please add them in the chat and we'll take them after a while. So let me start off, and I'll first of all go to Pamela and then Bill and then Neil with two questions. So first of all is, what are you most excited about in terms of what's going on in global health research? And then related to that, you can answer both or one of them. What are the areas of global health equity research that you think need more attention? And what do we need to do about that? So start off with you, Pamela.
Sure. Thank you. Thank you so much, David. Thank you for inviting me for this panel. And I'm pretty excited to be with you all this morning, faculty as well as the students who have joined. Thank you for carving out your time to listen to us. So to answer your question, David, I think there's lots to be excited about, especially the momentum and the attention that's been given to equity has received the attention that it's received in the global stage. I remember the days when I used to work on MDGs and we were tracking MDGs and there weren't any indicators to track equity. But if you look at the SDGs and the attention that has been given to SDGs and the volume of work that has come around this particular topic in the last 6 years, it's pretty impressive. So I'm excited about that. The second thing that I would be excited about is the attention on gender. It's no longer restricted to a comparison of coverage data between boys and girls. I remember looking at that data in the field and say, can we have much more than this? And, just being, someone who's been raised in India and all the different things that happens with the gender imbalance and what's going on and how women present themselves to their service delivery points, at what time, why, and all of those questions just come up in my mind when I just look at this data and say, not good enough. So the fact that there's a recognition that it's critical and that it is cross-cutting, including the maternal age, education, the agency, and the empowerment and their access to healthcare, particularly, services for adolescents, which is given more importance now, because I remember seeing DHS data and seeing the needle move, for married women, but then the overall data, data shows very clearly there's something these adolescents are missed out, and the focus that's been given to that is also very, very exciting. And also with the impact of COVID and the data that I'm seeing and what it means, the impact for female-headed households, and tailoring response for female-headed households, like demand-side financing that we were able to immediately put in place because that data was available and there was research available, just focused on the impact of COVID on female-headed households. That to me is pretty exciting. The other piece that's exciting is also the improvements in data quality. We are using now the traditional surveys and new technologies, linking data sets to electronic health information and reporting real-time data with rapid cycle monitoring. Then the data set on geospatial information gathering, looking at satellite imagery, GIS mapping that is coupled with surveillance data can identify hard to reach communities And these are good things, giving us more tools to be able to reach the unreached and the underserved. To me, that's an exciting thing as well. The other piece that is exciting is that we are moving from a more foundational research, which is much more exploratory, descriptive, to what I would say is a generative one, where more research is happening involving the end users and the stakeholder groups. In other words, like co-creating those designs, including the target population into the research is also an exciting piece. And it's, I used to see lots and lots of papers put out on a particular topic, but then what is it useful for practitioners and how much of it is actually used? Data use and the research use was limited, but now we're bringing that closer, and the data use side of it is also has been given more attention these days. So these are, I would say, my top four. The quality, the data part, the quality of data, use of technology, the data use part, moving from foundational much more into generative kind of research, and then gender, of course, is a big thing that's close to my heart. Thank you.
Thank you. And Bill, would you like to tackle those questions?
Certainly. Yes, good morning. Thank you, David. It's great to be with everybody this morning. Indeed, from the bios, you can see that I come from a little bit different background than my other two panelists, but indeed, the way that I am looking at the first question that David has posed is in a process sense. I am very happy that we are now looking and adopting much more of a systems change based approach to our funding and our approach to change. Systems change is something that has come about in a major way in the last 10 years. We had a conference about 4 years ago that had more than 400 organizations attending. And prior to that, I am sure that we couldn't have gotten more than 10 organizations to come to a conference discussing systems change and looking at the research in a systems-based format. So I am really encouraged by the concept of looking at things not necessarily pot-shotting, but systems being a major way to advance the concept of sustainability and scale. Those are the two areas that I am very interested in, for sure, in the health-based equity. And I think we are making great progress in both of those. Another way to look at that is that the funders and grantees are now really looking at answering questions about why and how, and not just what. To me, that is a major change in looking at the problems that we face and understanding where the solutions are coming from, and having them as a very structured set of strategies. On the other side, where we need a little bit more research or emphasis, to me, that is in what this day is all about, and it's collaboration. So often we are still working in silos. And I think the synergy and the benefits that we get from collaboration are so obvious that we really need to emphasize that aspect of the work and make sure that we are facilitated and encouraged to work as collaborators and not in structured silos.
Thanks, Bill. There's some good insights in reinforcing some of the points from Pamela as well. Neil, would you like to have a shot?
Sure. And the nice thing of coming third is many of the issues I would have covered, others have said. I guess what I want to begin with is early on in my career, I actually worked on a supplement with someone named Colleen Kivlahan. And Colleen was actually the Missouri Public Health Director. And what she wrote, which really resonates when we sort of think about this topic, is she defined public health as the convergence of science and politics. Equity is all about that. And I think as the work that you do, it very much infuses how you approach it. So you sort of straddle the world between being an advocate and a good researcher and working with others. And that just appreciating that that's a challenging space to be in, particularly with this topic. So for USAID, equity is an emerging administration priority, and it's being treated in terms of diversity, equity, diversity, and inclusion. And by that, what sort of the Biden administration means is both in terms of our hiring policies within the agency, but also how we work the sort of power balance between our foreign service nationals and our US-based staff, and really working on that is a real challenge. But it also has implications on how we program. And again, thinking about how that sort of influences. And certainly one of those components which there's active debate within the agency and planning is what is termed right now localization, which is very much trying to work on the power balance between donor and partner countries, and how we sort of work in such a way that the power balance shifts to people in the country, which, as you know, for any sort of donor, whether it's Gates or AID, or even a university like Hopkins, it's a challenge, and we have to really be mindful about how we do that. In terms of things which excite me, and maybe it's good that I'm talking to the Hopkins folks, is that someone named Paul Bolton, who is a Hopkins faculty member, is on an IPA, which is basically a loan agreement to AID, working on issues of mental health. And Paul, in his current role, is very much trying to straddle the world of equity and mental health and public health. And that's really sort of an exciting development for the agency. And we're really thrilled to have him with us. Within my own immediate group, we've been working the last decade on something which we called respectful maternity care, or more recently, respectful care, and very much sort of looking at the issue of the provider-patient relationship, the work that you at Hopkins have done in various ways, but also trying to link that as well as we think about more broadly the issue of social accountability. And so these areas nicely converge, but they're also really challenging. And I guess the final thing which I'm excited about, and I actually think for where you sit in academic institutions, a real opportunity, is that we see parallel developments, and we saw this in the past as well, between the US domestic public health work and the international work. And I'd really urge you to look at how you can create greater synergies. I mean, this takes us back to the Commission on Social Accountability in the past, Margaret Whitehead's work, but also something called Healthy People, which very much was tied to the issues of equity. I guess in terms of needs, and these sort of reinforces these 2 points. While I agree with my 2 other colleagues that there's a lot of progress, I work for an organization that is very much driven by the thought of what are drivers of change. And sometimes that may translate into how can we have better indicators? or ways to have policy dialogue to remove a complicated topic like that. Now, certainly that's not the only thing, but it's one of the things, if you think about whether we go back to the civil rights movement or the present day, what are the pieces of evidence that prompt a dialogue or help the advocates, whether you sit in a university or a government, to really try and move the agenda, and thinking about what are the things and doing research on that. I guess sort of the final piece where I think that all of you have a potential comparative advantage is that many years ago, Pat Rosenfield wrote this article in Social Science and Medicine, I think, on something called transdisciplinary research. And I think that utterly applies to the work that you're doing here in sort of the concept of bringing together the different academic traditions and trying to tackle the problem from different dimensions. And I guess as I think about what Hopkins has done, and I'm sure I won't cite all of the wonderful work, but the Tobacco Center aspired to do that many years ago as well. And I'd urge you to sort of re-embrace that as you think about how you can contribute to the area of equity. And maybe with that, I'll stop.
Thanks. That's a great set of responses. You know, I think as I hear from you, some commonality about excitement about the kind of data, the quality of data, and how it is being used by those affected, by those programming, and really that transition from descriptive to explanatory and moving them into action is really quite exciting. You also posed a lot of important things that need to be done that I'd like to come back to and ask you in terms of how. I want to ask you about how in your when you look at research or program proposals, how do you address some of those issues, particularly around collaboration across disciplines, but also between local partners and international partners? How do you address those power imbalances? How do you overcome silos? And so with that in mind, you know, what makes a good, how do you address those in the funding mechanisms or elsewhere in your organizations as you deal with, say, people that are applying for them, for grants? And so, you know, what would make a proposal stand out in those areas that you've highlighted as needs? So maybe we'll go in reverse order and maybe start with Neil and then try Bill and back to Pamela. So Neil, you want to take a crack of it, as you've been doing localization, so maybe it's good to hear what we need to know.
So, and I don't know if I can do credit to all of the topics you've raised, David, but I'll start and others will jump in. One of the trends in AID that we see in terms of the funding of the organization is that if you look over a decade or more, the budget of the central headquarters keeps going down. And that's because the determination that the organization needs to program at country level, and the thought that we need to respond to country priorities in such a way that, in fact, we try and work on the power and balance. Have we a perfect formula? Absolutely not. But the intention is there to very much work with local stakeholders in such a way that, in fact, it's driven more from the country level. In terms of, I guess, that sort of the issue of collaboration, I mean, it typically is, for those of you who apply to AID grants and cooperative agreements, you know, we very much look to you to propose a rational framework. And the thought that is really the opportunity for you to sort of think through. You begin with the assumption that you want to put the local partners in the lead wherever possible. And I guess really sort of want to credit when I've worked with Hopkins faculty, where there was willingness, even something as basic to the academic tradition of put the LMIC partner as the first author. And I realize that very much feeds into your promotion and other processes, but that's certainly a signal to us that sort of in terms of the value. funding obviously as well as a signal of what is the balance of resources if you're the group who's doing that. And let me actually stop there with maybe the final point that I do think that the biggest challenge for all of us is to do good transdisciplinary approaches. And that's something that you really have to work with your own institution. So over to the next speaker.
Thanks, Neil.
Neil.
Bill.
Yeah, as a small funder, where I am looking to fit in the spectrum of work is in high risk projects. Indeed, as a catalyst, as a agent of change, a project to me is very enticing if it is high risk. If the chances of success, as it's outlined, are questionable, and that's a little strange to say at times, but indeed that's the role that I look to play in this whole spectrum. And knowing that if something is proven, is found to be successful, I can then pass it off to those who have more zeros available, and it can be scaled and taken to the next level. But the role that I'm playing, the outcomes that I'm looking for are high risk outcomes, but to me, that's the role of a small independent funder to be playing in this field and any other field that we're looking at. Off to you, Pamela.
Thank you. Hearing Bill talk about the way he phrased it and framed it, interestingly, the foundation also thinks that they're not a large player at the table, but they really are looking at their catalytic role when they look at a proposal. They look at, okay, what's out there, who's doing what, and then where's the biggest impact that we can make. So that's the lens that they first look at, is what's the catalytic role, and how can we be additive to what's already going on, and what are the areas that we need to focus on. And clearly, what really stands out for us in a proposal is what groups or populations are the priority focus of this investment. Clearly, as a family foundation, there are priorities. Our strategies are approved at an annual base. There are clear priorities, and we would be looking at it from that lens to say, okay, what's the group population priority focus of this investment? And then how have you taken the lessons and best practices learned to inform your research questions? So that, it's a very data-driven foundation. Evidence is everything. Like it's incredible amount. This is like a university for various disciplines. Like, we have the IHME, we have so many people, like even, the big 5 consulting agency bringing in data from all sources. And so evidence is very important. So the question of how have you taken the lessons learned, best practice to inform your research questions is another piece that the foundation looks at. And then within the context of this investment, what and how can the foundation better support equitable outcomes for that population is another piece that we look at it. That's another lens these are the main questions that we look at, to see whether a proposal really stands out and it's good to invest in. And of course, we were very interested in having the affected groups involved in the research. And then talking about localization, the foundation is definitely, the foundation hasn't had a journey like USAID which has already had like a 10-year journey with the Administrator Raj having started the USAID Forward, and then comes the Administrator Mark Green talking about USAID Forward, and then now we have Administrator Samantha Powers is really pushing the localization agenda. I've been part of that journey as I'm an ex-USAID, having made that journey for 10 years at USAID. Coming to the foundation, I see a lot of lessons that the foundation can learn, but at the same time, the foundation can really sprint. So they're nimble, they're quick, and I can see them seeing all that information that they have gathered from multiple donor partners being taken into their current programming of funds, particularly focusing on localization as a key agenda. They have already finalized their diversity, inclusion, equity agenda, the framework, and all the funding. The teams have to be using that lens as well in order to program their funds. So having a local partner is not the only thing that we are looking at. Giving away a grant to a local partner does not necessarily take us to that outcome of localization. It's much more than just giving a grant to a local organization. It's much more than having a local person as a first author. We feel like there is this piece that Neil was talking about, is that power balance that needs to happen, which is much more than giving a grant to a local organization. Because as you know, the ecosystem that we work in at the country level and the power dynamics that takes place is also another piece that we take into account in our localization agenda at the foundation. So that, in a nutshell, is my answer, David, to your question on what really stands out. But I can just tell you a few priority areas where the foundation is, looking at in terms of the global health equity agenda later on.
Thanks. That's very good. I'd like to follow up also on the localization questions, because there's a number of dimensions. One of them is having local partners, and I think you've addressed, or a couple of you have addressed, how important that is. But there's also, the question of involving those that are intended beneficiaries. It may not be the grantee, but intended beneficiaries, or those that are affected by either the intervention or the research. How important is it to your organization to have both of those types, those local implementing partners as grantees, as well as engagement of those that are affected in the research? And then there's a question from one of the audiences. Then, how do we? Is there a case to how do you simplify proposal parameters to make it easier or simpler for leadership from low and middle income countries to be able to apply to grants and to be able to demonstrate leadership? So maybe I'll start from the middle, start with Bill, and then move out to Neil and back to Pamela then. Bill?
Yeah, indeed, local involvement is key for me. One of the things that I go after, and I put at the top of my list, is local empowerment, and that to me is the ultimate goal that we're going after, because the local presence is the one who is going to be there after all of the funders and the bilaterals have left, and that is what creates the sustainability. And that is one of the key goals that we're going after these days, is sustainability. And so local involvement from the start is absolutely key. I think the second piece of the question is probably best answered by my other two panelists, as I really don't have a way to address that that area. I don't tend to get into that form of structure. So
Thanks.
thank you.
Thanks. Neil, do you want to try?
Sure. Well, I guess I'd sort of go back to where I began, which was Colleen Kivlahan and the convergence of science and politics. And this is a little bit of a tricky issue for all of us when we talk about equity. And let me give an example where it sort of came in place. So we started supporting over a decade ago work in Kenya on the issue of respect maternity care, making sure a woman is not abused when she turns up to give birth. And what was interesting about this topic, it was the subject of lawsuits in Kenya, that there was some attention but not action. And our early work on this, it was perceived as a foreign concept, foreigners coming in and imposing their value systems on certain people. And, you know, part of the way that this agenda evolved in Kenya, and it's still a work in progress and by no means fully solved, it is that it was the ownership of the local people, not necessarily the researchers, but in fact, the researcher was very clever in getting the mid-level people in the Ministry of Health to lead the effort, to be part of the effort in addressing the problem. So in part, it's how you sort of shaping who drives the agenda and how you're responsive to the agenda, balancing between the requirements of the funder, the university, but also being sensitive who at the local level will be the champion, but also owns the topic. And that's not at all easy. And I'm not going to pretend that there's a solution, but it's in part how you approach it from where you're sitting right now. In terms of the AID approach, we have continued to work on ways to simplify grants and other types of agreements at local level to allow local groups to apply. We also have done, as I believe Gates and others have done, twinning proposals, where it's sort of the gradual transition of sort of power and authority and funding. Both work, neither are perfect yet. But there again, it's a challenging area for all of us. And in part, I guess we turn to you to think about where you sit. How can you affect that power dynamic?
Thanks. And Pamela?
Definitely, that is a priority for the foundation, David. The fact that we have to involve not have to, like, you know, affected groups involved in the research is something that the foundation is really looking into as well. And talking about the localization agenda, there are quite a few things that the foundation is currently doing in terms of embracing this concept and actualizing it, how to go about it. So there's a lot of work that has been assigned to different agencies. They have contracted the change labs to look at the systems thinking and the ecosystem that we work, to look at what it's not just about one university in one country, but it's the ecosystem. It's how does this academic institution work with the government, which units of the government do they work with? What's the link? What's the power dynamics that's going on between the local ecosystem and the ecosystem to which that university is connected to the funding agency, as well as the Northern University? These are things that we are looking at, and I would say that you know, it's definitely pieces of work that has been. We're waiting for information and study results of systems thinking of the ecosystem in which we work. We are looking at also, you know, regional platforms that can be empowered to be able to lift up the researchers in the South to build the capacity and see how we can shift some of the decision making to our Africa office and our country-based office, including funding you know, as you know, the foundation is a very Seattle-based organization. All decisions are made in Seattle, but now that is shifting as well. So our country offices are getting more power to make those decisions, being close to the communities that we work with, being close to the actors that are making those decisions and making those calls. So that's a big shift that's happening within the foundation, and they're really moving very fast. Every team is expected to be accountable for those indicators that our leadership has provided. So it's not just like words, but it's being translated into indicators for each of the teams to deliver on it. So when we are doing the programming, we are mainstreaming localization into our programming as well.
Thanks, that's great. And actually there's a follow-up question for you from the audience that I'll just follow up on. That is about, you know, how you aim to empower local efforts. And you've described that through some of the regional and country hubs. The question specifically is about how do you empower local groups that may not have the resources to put together a top-rated proposal, and then how do you weigh the risks of investing in, say, less established organizations with that balance of trying to empower less established organizations. You know, so it's that investment. It's a bit more of a risk, I guess, in the terms that that Bill put. But how, if you can describe a bit, if there's any movement there, and thinking about say, you know, less well-established organizations locally.
Yes, definitely. Thank you for the question. So one of the things that the foundation is doing, I mean, I know of several, but I'm going to focus on this one, which has really proved to be effective, at least in the little that I have seen within the foundation, is that within the Seattle group, they have, we have nominated different people, researchers, who will be actually the interlocutors for the local institutions that doesn't have the same capabilities as a well-established institution. So we have mentors of local institutions. And I won't be able to name those, but I know that we have mentors for several institutions within their thing, and they are more or less like the mentors for them, but also the interlocutors for the people who are making decisions on the Seattle side. In terms of risk, I think the organization is pretty nimble. I mean, coming from USAID and everything that we need to take care and put in place, and before we could put the grant out, we do have pretty rigorous, you know, reviews and conditions to meet in order to put the grant out. But at the same time, we know that our leadership is willing to take that risk in order to develop local capacity. We've also done quite a bit of work in terms of looking at the ecosystems in about 8 countries on how research is taking place, particularly in the area of health systems evaluation and the fragmentation that is existing between the research community and the decision makers. So that's another area that we are focusing on at this point, because it seems like there is a imbalance between what the donors actually want to evaluate and research on, and what the country needs to actually do, and the countries having to be in the driver's seat and taking that ownership to say, okay, this is what we want to research, not particularly the impact of one particular disease that the donor would like to. So that kind of a conversation is already starting, and it's very gratifying to see that we're looking at a broader health systems and country ownership of the research agenda instead of being driven by the donors.
Excellent. That's great to hear. Let me take a question here about that was written about health equity tourism that you might want to address, all 3 of you. The argument is that, you know, with increased interest by funders in health equity, many researchers not who had previously not prioritized health equity issues are moving into the space, yet they don't have the foundational knowledge or experience investment in examining global equity or global evidence around health equity. So the question is, what are strategies that funders can use to ensure that researchers moving into this area are prepared, and that you're ensuring that you're supporting those that are committed their careers to health equity in terms of leading these projects? So Neil, maybe you want to try that, and then I'll try, and then I'll ask Bill and Pamela if they want to address the question as well.
That as we looked at one point, we worked together on something called implementation research. And maybe by way of example, that we're trying to spawn a movement and a thought shift in the academic community. Part of what we've seen is there's been an adaptation of some of the principles. There's also been some lip service to it in terms of labeling. And I think it's as much sort of on the end of the donor as it's of the sort of the partnerships in universities to make sure that in fact we're true to what we're trying to accomplish. It just, I don't think it's not a simple process, but by the same extension, I guess part of what we found as we've done this work over the years is sometimes if you want to create a movement or advance an area, whether it's equity or otherwise, you need a broader community to buy into it. And almost by definition, that means people enter in with less skill sets. And hopefully that sort of changes sort of the tide or the movement of the work as a whole. So I don't think it's necessarily a bad thing to have new entrants, but it's also incumbent on all of us to sort of guide in both in the way proposals are reviewed, but also how they're prepared.
Good point. And the example of implementation research was very much about democratizing research and using it. And so you have a lot of new learners, and that's also the case here in health equity, which I see overall as a good thing as well. But there are the downsides of those that don't really know the space getting ahead of others. Bill, did you want to address this?
Just quickly, in a sense that, you know, I come at this from a background of finance, and 10 years ago, I knew nothing about public health. So indeed, it has been a learning process for me, and I find myself getting very personally involved in the grants that I'm making, in my partners, and it's really incumbent on me to have a knowledge set that I can talk reasonably to them and ask the right questions, help shape and direct, and make sure that we're on the right track, and be open to change along the way too. You know, we don't know the answers that we're looking for necessarily at the beginning of the quest, and so I think we all have a responsibility to continue to be educated, to continue to be informed in the changing environment that we find ourselves in, for sure.
Okay, so David, for me, I would like to first congratulate the student or the faculty that put out the question. I really would like to thank them for that, because I mean, this is not merely an academic discipline. And if you're, I mean, at least from my lens, when I look at a proposal, you can see if a researcher is actually doing it from an academic discipline or has a quest for equity and is solving a collection of problems. And that comes through in the proposal if it's well done. And you can see those words come through in the proposals. So hopefully the people who are reviewing these proposals have that lens to see that, you know, it's not like, you know, looking at doing a kind of a Cochrane research and putting in all those evidences and lessons and best practice and coming up with a good proposal. It's the quest. that the way they address the collection of problems that turns on the quest to get that equity is the piece that I'm hoping that the funders of research would be looking at, and hopefully in doing so we could fund the folks who have been in this field for some time, and not that they have to be the people who have been in the field for a long time. We have to encourage new researchers as well, but mentor them to have that, to turn on the quest for equity instead of just making it an academic discipline. That's my 2 or 3 lines on that.
Excellent, and that's great advice too, that you're giving to new investigators or young investigators. That this has to be something that you can turn into real life and action. So that's good advice. Others may want to comment on that too, in terms of what advice they would give to people coming into the field. But I want to switch to another question that was given, and I think it's directed at you, Neil, and Pamela, about how do you promote health equity in countries where that is not a priority, and where clearly programs, practices, and the experience is not one that is promoting health equity, social justice. What's the potential to facilitate practical research projects in those settings, and how do you go about that? So Neil, maybe you want to try that, and then.
Sure. Well, I think part of this speaks to, at least from the US government side, the House that I'm not involved in as much, which is very much the whole issue of diplomacy and dialogue. And that's part of the whole issue of the engagement. But within sort of the realm that I think all of us operate in, it's very much in the way that we've approached it. It is looking at opportunities to create communities of practice that support champions within countries, linking them to others. I mean, you at Hopkins have been part of the tobacco control and other communities where you've done that for years. So in some ways, this is not a new concept for any of us, but it's also one that requires sometimes years of engagement together to really sort of build up the capacity and have that sort of momentum, so that when windows of opportunity open, and usually they're gradual, that in fact we can reinforce them.
Thanks. Pamela, Bill, Pamela, do you have any comments on this?
Yeah, I would say that COVID has demonstrated that no amount of biomedical capacity can overcome the societal failures, right? So I think that power and economic divide that underpins the failures in society, it's not just talking about extreme poverty, but why is the area of research that is absolutely needed. And particularly now that we have, COVID has laid bare many equities that are there, suffering between and within the countries. And I think that's an important piece that we need to be looking at, is the why side of it, and looking at not just a narrow definition of health, but looking the lack of focus on social determinants of health, and the physical and social environments that we live in is also becoming very, very important. I mean, just take for example, when COVID hit, the countries which had this global security index, I don't know if folks have just taken a look at the index that was created, Global Health Security Index, and you had these high score countries, grappling with COVID, whereas the countries that was marked as lower scores, who were not ready for resilient health systems, actually performed better than the ones that had a very high score. That tells volumes. So I think more unpacking those things are going to be an important thing to do in order to address this issue. Thank you.
Thank you. It's a great point that there is no place where there's structural and policy programmatic issues that are creating inequities and injustice. And some excellent examples, including one that Hopkins had a lot of part in developing the metrics. Bill, did you want to have a comment on that question?
Just quickly on the way that I go about it, I look for good NGO partners who are indeed wrestling with questions in difficult places. And my proactive looking has been able to uncover a number of partners that are very happy to be working in difficult situations. And particularly in the faith-based community, I find that there is no dearth of actors who are able to and willing to take difficult challenges. So I think if we look a little bit, we can find the right partners to work with for sure.
Thanks. And we're coming to the end of our panel session, but I wanted to go quickly to give each of you a chance to either give a last comment. I realize we didn't get to the explicitly to the question of, where will health equity fit in your prioritization of funding in the future, although you've all mentioned it to some degree. So if you'd like to give a last comment, maybe addressing the question or reinforcing the question of where health equity will be in your priorities in the future, please do so. So we started in one order. Why don't we go back to reverse order and start with you, Neil, and then move to Bill and Pamela. So where does, last thoughts, or where does health equity fit in the future of USAID funding?
So I think as I began, with the Biden administration's approach to this topic, stemming from executive order for the federal government as a whole, this is a central area for us to grapple with. And so it's very much front and center of what we're supposed to be concentrating on in the years ahead under the Biden administration. I think you heard the same thing from Pamela Rao at the Gates Foundation. Do we have it right or perfect yet? No, but it's a commitment to keep working on it. This is a complicated area for all of us. And I guess the thing which I'm struck about this topic is that in some ways for all of us, it's sort of figuring out our role in terms of how much are we advocates for equity, how much are we supporters of those advocates, and how much, very much as we've talked about during this half hour, we're listening to the people at country level about the topics they want to drive and responding to it. So let me stop there, and I really have appreciated the chance to join this conversation this morning.
Thank you, Neil. Bill.
Certainly. Indeed, I guess it may be no surprise that where I'm headed with health equity is in creative financing. There is so much need on the financing side of absolute dollars. How do we do it differently? Where do we decrease the risk? Indeed, that's where I'm very interested in pursuing solutions. Whether it is carbon financing or outcome financing, I have an opportunity now to actually put a value on women's work and utilize that to decrease the price of clean cooking stoves. It's absolutely fascinating to me at this point, and that's where I hope to be able to make a difference, have some impact, and hopefully change the lay of the land when it comes to financing in the health equity area, for sure.
Thanks, Bill. And Pamela, you get the last word.
Sure. Thank you, David. For the foundation, I would, if I were to put the top one, it would be gender. we are putting in a lot of effort into it. We recognize that we need to do more in this area, particularly going into inequities caused by bias and discrimination, and also the social constructs in which the women access healthcare or not access healthcare, and the ethnicity aspect of it as well. So these, what are the gender-related barriers? What's the power dynamics? What's the ecosystem and the political economy in which they need to go about their life is something that's really a big focus for the foundation right now. The second one I would say would be the area of, as you know, the foundation has put in a lot of effort into vaccines and immunization agenda, having been the key player in establishing Gavi. So one of the focused area is the zero-dose children, which means, the definition here is kids who have not had even a single dose of DTP. So what's happening here, basically? It's not just about these kids. But it's the communities that they belong. It's not just the kids that are missing the dose, it's the communities that are missing access, and they're being missed at multiple levels of the health system. And what's actually going on over here? The other piece of it is also revitalizing primary health care to be able to get that access to this hard to reach population and communities which are being missed at multiple levels of the system. What's the kind of service delivery design we need to be doing to extend care if we want to achieve the universal health coverage? So really very focused attention on zero-dose communities is also a big priority for us. I would say that the other piece would be going a little broader into the social determinants of health, looking at also the social protection now that the COVID has hit, looking into connection between social protection and health is an important piece, looking at the social economic divide along with the social and ethnic divides that really greatly undermines the type of response that we put forward without taking into consideration all of these different pieces. That's another area which we will be definitely focusing on. The other piece that I would say we need more, would be a priority, is the urbanization that is happening. As their countries, low-income countries are graduating into low middle-income countries, and we see that increased proportion of population in urban areas being missed. And it's another area that we, the gaps in the education, the unemployment risk that's there for those people who live in poor housing conditions in urban settings is another area that definitely is coming up in conversations on how do we tackle the urban poor. So I would say that these are some of the key areas. Gender would be big. Zero-dose communities, another big area of priority as well for us.
Thank you, Pamela. That's an exciting agenda, as you've all laid out. Let me stop here and thank you for a great discussion, great insights, and really want to thank you, and also thank the audience for questions that they've gave that have been quite probing and very helpful. I've learned a lot. You have emphasized the importance of learning, listening, acting, the excitement of how the research is moving to be looking at more explanatory and understanding where solutions come and being applied to new solutions with emphasis on collaboration. So thank you. You're all reinforcing the kind of work that we're moving. So what I'd like to do is again, thank you. I appreciate your time. I'm going to give a brief announcement about an upcoming funding opportunity for the Alliance, and then we'll move into the speed networking. So thank you. Thanks again. So to faculty and staff, I wanted to introduce that we now have another set of Alliance for Healthier World impact grants that has been announced. If you go to our website, the request for applications is out there. This is a purpose of this is really to fund early stage funding for multidisciplinary teams across Hopkins and with local partners to develop and test solutions or interventions around an important health equity challenge in communities in low and middle income countries. You can have an issue that addresses things around structural determinants of health, common goods for health, and health equity knowledge management and translation. Should be able to address one or more of those types of themes. But really we want to, the grants that come out will involve co-leadership from both health science and non-health science divisions, and that you can demonstrate a pathway to continue projects beyond the initial investment. Now the grant is for $100,000 and it's to be implemented over a couple of years. And we're excited about how that's going to work. So again, if you want to look for the actual RFA is in the chat in terms of the link for that, and hope that many of you will apply. The deadline is at the end of April, so we've got another 5 or 6 weeks at this point to work on that. So with that, I would now like to turn over to the next section of the plan, and this is really around speed networking. Well, I think we've all come back from the breakout rooms. We've had lots of people join today, lots who have also signed up and want to hear the recording of this. This was very exciting. It was great to hear from very different perspectives of people involved in funding of global health on equity issues. I want to thank you for joining and sticking through to the end. I think there was lots of real excitement, both about things, how the field has changed, how there's so much more attention on health equity, and how much farther we have to go. We're challenged to do good research, but not to just sit there, to get out and engage and make sure that the research is collaborative at addressing real problems and makes meaningful change. So that's a challenge to what I think is the shifting face of academia as we move into politics and practice. So really excited by that. I also glad that you got to meet each other, hopefully new or old acquaintances coming together, well, old or long-standing, let's put it that way, and thinking new. So that's great. And again, happy to just also delighted to announce the new grant that the new grant scheme on health equity. And I hope that you and your colleagues will take a look and apply. And of course, we'll have sessions to do question and answers about the grants, but I'm excited about the work that we're going to be doing from here. So I don't know, I just also want to thank the team, Ashley, Jessica, Chris, for putting this together. I think it was really helpful and an exciting time. So with that, Nancy, thank you, and your leadership as well on the steering committee. I'd like to thank you all, and we will look forward to the next engagements.